Hello, my name is Matthew. I'm a family nurse practitioner student, and I wanted to conduct a health history interview today with you. Can you tell me your name?
Michelle Carter.
And how would you like to be addressed?
Michelle is fine.
Michelle is fine. Okay, great. So the reason for this interview is to find out a little bit about you, see about your health history, your personal life history, your social history, your family history, and it's going to take about maybe at the most 15 minutes. It is strictly confidential. It's just between you and I. Do you have any questions so far?
No.
Great. Overall, Michelle, how have you been feeling?
Great.
Good. That's good to know. And what brings you in today?
I'm looking for a primary care physician.
Okay. Let's talk about some of your family history. As far as your family goes, is there any history of cardiac disease, heart disease, anything like that?
No.
Do you know of anybody in your family that has any lung disease?
No.
Possibly any diabetes?
No.
Any autoimmune disorders? Do you have siblings?
Yes.
How many siblings?
5.
And they're all pretty healthy?
Yes.
Great. Is your mother and father still living?
No.
Okay, I'm sorry to hear that. When did they pass away?
My mom passed away 4 years ago.
Okay.
My father passed away 28 years ago.
28 years ago for your father and 4 years ago for your mom. Do you know what they passed away from?
My mom passed from uterine cancer,
Okay.
and my father passed from cirrhosis of the liver.
Okay, good to know that. But no history of that with you. Okay. So what about yourself? Have you had any appetite changes?
Somewhat.
Okay.
Mm-hmm.
Do you know what that could be possibly attributed to?
I believe it's from my cycle.
Okay, from your menstrual cycle. Have you had? I see you wear glasses.
Mm-hmm.
Do you have any visual changes? Have any visual changes occurred?
No.
Any double vision?
No.
Any like eye strain problems like that?
No.
Okay. Have you had any problems losing weight or recently or gaining weight?
No.
Okay. What about your throat? Any sore throat?
No.
Okay. Have you had any shortness of breath? Let's think about your lungs.
No.
Do you have bronchitis or any
I have
lung?
a bronchial issue.
Yeah, bronchial issue.
Mm-hmm.
Do you take medication for that?
Yes, albuterol.
You take albuterol.
Mm-hmm.
Is that via nebulizer or is it by a inhaler?
Inhaler.
And how often do you use that?
As needed.
Okay. Do you need to use it a lot or?
No, it's like if I get a cold and I cough,
Mm-hmm.
that helps me breathe when I'm sick.
Got you. Okay. Have you had felt any heart palpitations?
No.
Any irregular heartbeat?
No.
Have you passed out recently?
No.
Okay. Let's see. What about any swelling in your legs?
No.
Okay. Have you had a bowel movement recently?
Yes.
Do you have them on a daily basis?
Yes.
Okay. Anything going on with your stomach?
Only around the time when my cycle is coming.
Okay. Do you have around that time? What happens with your stomach?
It cramps up severely, almost debilitating.
How do you manage it?
I try to take ibuprofen for it, and sometimes that don't work.
Okay.
But other than that, I just have to wait it out.
How long does it usually last?
It could last for a good 3 days.
Okay. I'm so sorry to hear that. Do you ever feel like your stomach is bloated or?
Yes, just around that time.
Just around that time.
Mm-hmm.
At that time, is it tender?
Not really, no.
Okay. Is it tight?
Mm-hmm.
It does get tight. Okay. What about urinating?
No problem.
No problems urinating. Have you seen any blood in your urine?
No.
Any foul smelling urine?
No.
Okay. Have you had any broken bones?
No.
Any muscle tears or strains, anything like that?
No.
Okay. What about bruising? Do you bruise easily?
No.
Do you have any like problems? Like if you get a cut, do you have any problems clotting?
No.
Like stopping the blood from bleeding? Okay. Have you had any bad thoughts or thoughts of harming yourself or anything? No. Okay. What do you think of your current level of health?
I think it's average.
Do you?
Mm-hmm.
Great. Do you think you can? Do you think you need to improve in any areas of your life or
Probably working out.
working out?
Mm-hmm.
I can agree. I need to do the same thing for myself. What do you enjoy in life?
I enjoy just hanging with my family and friends and just coming together.
Good.
Mm-hmm.
So your family and friends are a big part of your life?
Yes.
That's awesome. Are you employed?
Yes.
Good. What do you do for employment?
I'm a warehouse worker.
Warehouse
for
worker.
Amazon.
Okay. Awesome. Do you have children?
Yes, I have two.
Have 2 children. Have you ever had any miscarriages?
No.
With those children, were they vaginal deliveries or were they cesarean deliveries?
Both vaginal.
Both vaginal deliveries. Have you ever had any surgeries?
No.
Okay, let's see. Are you a smoker?
Yes.
Do you smoke cigarettes or
I smoke cigars.
cigars? How many cigars a day do you smoke?
Maybe 1 or 2.
And for how long have you been smoking?
I've been a smoker since I was 18.
Okay. What about alcohol use?
Occasionally.
Occasionally. How many drinks?
On occasion, 2 is my minimum.
Okay.
Actually, my maximum.
Okay. All right. Are you sexually active?
Yes.
How many partners do you have?
1.
And about how often do you engage in sexual activity?
Daily.
Okay. Now you said you could probably beef up on some exercise in your life. Do you have exercise? Well, you said you're a warehouse worker.
Yeah.
So you walk a lot, I
Yes,
gather.
yes.
What about exercising?
No, not really.
Okay. Let's talk about school. What was the highest level of education
12th grade.
for 12th grade? Okay. Well, I think that was all that I needed to ask. Do you have any questions for me?
No, not at this time.
Well, I thank you very much for your time. If you do have any questions, feel free to contact me. I'll do the best that I can to answer them for you. And we look forward to seeing you in the future.
Well, thank you.
Thank you very much.
Thank you. Have a good day.
You as well.